Hello, my name is Tamas Szakmany, the Associate Editor for Social Media at Critical Care Explorations. Here are my top reads from Critical Care Explorations this month. In an international cohort study, Lee Bassi and colleagues evaluated the risk factors for mortality for COVID-19 patients in a multinational study involving over 1,500 patients. They found that age and clinically relevant but routinely monitored variables such as PEEP, PaCO2, MAP, lactate, and creatinine were associated with worse outcomes. Their results highlight that there might be modifiable disease processes which could be exploited to achieve better outcomes. Thiamine supplementation might improve the rate of oxygen extraction in hypoxemic states. A phase 2 randomized controlled trial from the US evaluated the effect of single-dose thiamine on oxygen consumption in mechanically ventilated patients. Dr. Berg and colleagues found that in the 56 patients randomized, thiamine did not alter the oxygen consumption, even in the patients who had thiamine deficiency. Their results suggest that thiamine might not be the universal metabolic resuscitator in critical illness. Improving communications with relatives could be achieved in multiple ways. A randomized trial from Baltimore, Maryland, led by Dr. Al-Ghnaim and colleagues, examined if chaplain patient navigators would enhance the care of critically ill patients. Disappointingly, they found that the intervention of introducing a new member to the team to help families processing the many times overwhelming information and emotions of a loved one cared for on the ICU didn't affect any patient-centered outcomes and was associated with increased ICU and hospital length of stay as well as costs. Finally, a before and after study examined the effect of introducing procalcitonin-driven antimicrobial stewardship in an academic tertiary center. Dr. Chow and colleagues found that after introducing procalcitonin-based stewardship across the hospital, there was a significant reduction in antimicrobial exposure on the ICU, with no detectable change in any of the safety outcomes and no change in mortality. They also found a significant cost reduction despite implementing this costly test. The hypothesis-generating results could point towards using this biomarker more effectively to help reducing the rise of multi-resistant organisms. Please take time to read these articles and more by visiting ccejournal.org. Also, follow us on social media at CritCareExplore. Stay safe, everyone.